Healthcare in the Fourth Industrial Revolution. The S-bar analysis. Technology in healthcare can serve as an equalizer while also creating inequalities. Healthcare technology is not easily accessible around the world, but on the other hand, technological discoveries have taken us in the right direction for safer and more efficient practices around the world. New technology has allowed scientists to find cures and preventatives that they have struggled to find in the past. For example, during colonial times, mortality rates were extremely high. This led to the development of vaccines. American healthcare has had a different development due to a more capitalistic approach compared to its European neighbors. During his presidency, Theodore Roosevelt stated that no country could be strong whose people were sick and poor. And in the 1950s, the first organ transplant was performed. Also, during this time, the price of medical care doubled. Now, with COVID-19, vaccines have come relatively fast and are being distributed based on vulnerability.
New technology has improved efficiency on scale, scope, and speed. Technology advancements have played an important role in medicine innovation, shaping various areas such as business operations, the economy, and improving people's health around the world. Technological discoveries have allowed doctors to provide safer and rapid comprehensive care that has increased the quality of life for many people. On the graph to my right, there was a survey conducted by Healthcare IT News in which they surveyed providers, payers, and non-providers working in the industry to determine how much they are prioritizing digital transformation in healthcare. Participants were asked how important innovation was to them on a variety of areas such as operational process, patient experience, new models of care, new treatment approaches, and as you can see from the black, blue, and orange areas correspond to more than 50% that believe innovation is of critical, high, or moderate priority, and only a small percentage believes it is of low or not a priority at all, which shows that innovation is important to most healthcare organizations. On the graph to the right from the same survey, they gathered information about ways in which progress is being made with digital transformation in the health sector, and they got a 66% progress shown into fragments with 7% fully executing digital strategy, 33% making changes across the enterprise, 26% making changes on departmental or specific use case basis, 32% still gathering information, formulating a plan. So we can say institutions have made a great progress embracing digital transformation in the healthcare industry. But the next phase, we hope that it will be focused on accessing, sharing, and using the information as well as combining it with other data sources which will require new technology. SWOT analysis. Here we have a few examples of some of the technological strengths in healthcare that impact the well-being of society through efficiency and accessibility. Digitalization of patient records. There are various ways in which this has made a big impact for efficiency and accessibility for health providers and patients. This helps keep detailed and organized records, providing accurate, up-to-date, and complete information about patients, which help care providers make better clinical decisions. Another one being telehealth, which is the use of electronic information and telecommunication technologies to support long-distance clinical healthcare. Technologies include video conferencing, the internet, store and forward imaging, streaming media, and terrestrial and wireless communications. We also have vaccine technology. COVID-19 vaccine is a good example of the most recent innovation created only under 1 year, when it usually takes about 10 to 15 years on average. Technology also plays a big role predicting epidemics. Web-based surveillance tools and epidemic intelligence methods are used by all major public health institutions intended to facilitate risk assessments and timely outbreak detection. And the most important strength is the fact that new innovations in technology have not only made our medical experience more convenient, but it has also improved our quality of life with the ability to provide surgeries, medications, and more.
To begin discussing the manufacturing strengths, the Fourth Industrial Revolution has brought us many new devices, which are set for about a 28% growth each year until at least 2027. This has offered many opportunities as significant business diversification and growth in wearable technologies. Some examples include Fitbits and smartwatches, at-home wearables for patients who can't travel, and other devices that can help diabetic patients, the Freestyle Libre flash glucose monitoring system for self-management. These have been incredibly helpful throughout the past year with COVID-19 and helping citizens feel safer while social distancing at home and feeling less of a need to visit doctors' offices as often. These devices are also worn by children to help parents and other caregivers keep track of them. Within these devices are biosensors that collect real-time data on patients in unpredictable or unstable conditions. Material and design choices to increase products' productive lifespan. Good medical manufacturers know how to spot useful and novel materials to meet these needs, which in return allows them to do well in growing markets. One example is using thermoplastics and coated fabrics to create flexible products that offer a sense of durability and strength and leak-proof performance, even for sensitive electronics. Other examples involve taking materials that are already common in medical manufacturing and using the new techniques to improve them. Take nickel, for example. It is a high-performing metal common in medical devices already, but a hybrid fabrication technique further enhances the strength, corrosion resistance, and ductility. Manufacturers simply must be able to demonstrate their products are safe and reliable throughout its life cycle, so continuous and efficient monitoring is imperative. For additive manufacturing, an example would be 3D printing. A visual example of the 3D printing is to the right of this slide. You can see a human skull where a 3D printed model, the gray area, is attached. This is used in replace of the missing bones and fragments. 3D printing can create many types of medical devices from metals, plastics, hydrogels, and even biological materials. 3D printing can enable the production of increasingly complex parts and ever finer solutions, meaning that implants and prosthetics are now being tailor-made for individuals. And next is the unique methods of verifying the quality and cleanliness of products, which is probably the most important part within the manufacturing, because manufacturers have unique methods for verifying the quality of products as well as the cleanliness of the manufacturing environment, including ultrasonic cleaning and even automated inspections.
As for economic strengths, it is important to take into consideration that healthcare is the fastest and largest growing sector in the United States economy. With that being said, the Fourth Industrial Revolution has the potential to bring in more job openings such as nursing positions, health techs, surgeons, radiologists, and more. Ultimately, this helps decrease unemployment rates. In addition, this brings in new investments in medical technology by business owners, which positively impacts the economy. COVID-19 has also impacted the US greatly by causing a widespread need for digital healthcare. As shown in the graph, the digital health market is expected to grow significantly at a rate of 28.5% through 2026. This means that healthcare will be a $639.4 billion industry within the next 5 years. As for weaknesses, there is an increased risk of hackers getting into medical records. This is a pressing concern because it can be very dangerous for patients if a hacker was to have access to their medical records. It can be hard to prevent something like this from happening if all medical records are being stored digitally. In addition to that, there is the risk of technological errors occurring. Examples of this would be the possibility of medical records being erased and machines malfunctioning. This leads to another disadvantage considering that there could potentially be a lot of recalls and some of the issues can be time consuming to fix. Since most of the technology is new and advanced, it could take engineers a while to figure out how to fix the problem. There's also a risk of mixed diagnostics with virtual healthcare. This method of healthcare has become increasingly popular due to COVID-19. It can be difficult for a doctor to provide proper care without seeing patients in person. Lastly, technology advancements in healthcare can ultimately increase the cost of medical services, which can be a financial burden.
Moving forward, a few opportunities that are presented include continuing to become more accessible to people across all economic backgrounds. This was found within the public finance lecture. Continue to research to find more cures with growing technology. Create stability for societies as more information on disease is discovered, and this was found within the social protection lecture. Prevention before infection, also found in the social protection lecture. New technology and new markets and services. However, there are some threats as well, and these include less accessibility to healthcare, higher rates, privatized healthcare, and security breaches.
Our verdict on healthcare technology. As a society, we have come a long way in regards to making newer, more advanced technology, increasing convenience and safety for providers and patients. We touched on the strengths and some of the weaknesses in digitalization, manufacturing technology, and from an economic standpoint, how this market is expected to grow drastically for the next several years. And although there are some concerns for cyber risk, errors, accessibility, and more, we believe that the advantages outweigh the disadvantages. By using big data that captures millions of interactions among US healthcare providers and patients, we hope that there can be a bigger focus on reducing healthcare costs while improving patient outcomes. We estimate that the next phase will be focused on accessing, sharing, using the information, as well as combining it with other data sources.